Time now for what's going around here on the 4 o'clock news, and we're talking with local doctors and nurses to find out what issues they're seeing in the office lately. I'm joined today by Dr. Raymond Romano from MGC Family Medicine in Five Forks. Thanks so much for being here today. And I think the big thing right now is seasonal allergies. Kinder puts that map up every day showing, the range of it. Seems like every type of allergy or pollen is high right now.
Yeah, thanks very much for having me here today. And absolutely, one of the things we're seeing the most over the past several weeks in the office is people coming in with upper respiratory complaints of nasal congestion, runny nose, cough, watery eyes, itchy eyes, and overwhelmingly these are due to the high pollen counts that are in the air, and people are getting that in, they're breathing it in, getting in their eyes, and having all these symptoms that are so bothersome, so problematic.
And when do you tell people it's time, maybe to go see your doctor? It may just not be, get over it in a few days, just the pollen being high. When's the time to come in and see you guys?
Sure. So a lot of things can be managed with over-the-counter medication. A lot of treatment for allergies is really treating the symptoms. It is, doing your daily antihistamines such as Claritin or Zyrtec, or one of your nasal sprays, nasal rinses, those types of things. When something becomes iffy, if it's a little bit more problematic, that you're having sinus pain or pain in the ears or a cough that is becoming a little bit more severe than just what you may consider typical for allergies, is probably time to get checked out to make sure that nothing more significant is going on.
And what do you tell people, they kind of wait and wait and wait? I mean, because it can develop to be more than just, average sinus infection?
Well, typically, so allergies, of course, can cause chronic inflammation. And for the most part, if something is just not abating, but really not getting better, not getting worse, it is probably not a true infection. What chronic allergies can predispose somebody to, of course, from the congestion, the swelling, retention of mucus, would be something like a sinus infection. Now, that would be, of course, something that would need to be treated with an antibiotic. Not just with an anti-allergy medicine, but that is something that would need evaluation.
And what else are you guys seeing right now? I know, of course, sinus is a big thing. What else are you guys seeing patients walk in with right now?
So a lot of irritated eyes, watery eyes, itchy eyes, and like anything else, everything is covered in pollen. So if you have pollen on your hands, or you touch your car door and you open your car and then you rub your eye, you're going to have that pollen in your eyes, and that's going to cause what some people call an allergic pink eye. These are things that if you wash your hands, and you can use either an over-the-counter saline drop, or they do make over-the-counter allergy eye drops, can be very, very helpful for people. If it's something that continues despite the use of an over-the-counter remedy, probably something you need to be seen for to make sure it's not anything worse.
And I know we did a story this week about across the country, some flu still coming in late. I kind of asked you about that. Are you guys seeing the flu drop off in the upstate, or is it what are you guys seeing with that?
We've definitely seen a considerable drop off with the amount of influenza that we've seen in our office in Five Forks. We have not had a confirmed flu case in about 2 weeks now. I know that some of the urgent care centers are sometimes still having the straggler here and there. The difference between flu and allergy, of course, is going to be, for the most part, fairly obvious. High fever, systemic things like chills, muscle aches, body aches, cough, those types of things that would be significantly different than an allergy type symptom.
All right. Well, Dr. Romano, thanks so much. I appreciate you being in with us.